Here's a very short lesson on bone fracture types as viewed in X-ray images. First we have the transverse fracture. Transverse means across, so this is a fracture that occurs perpendicular to the bone. It's just a break straight clean across the bone. Here we have an example of a transverse fracture that has occurred in the fibula of the lower leg. Then we have the oblique fracture. An oblique fracture is similar to transverse except that it's not perpendicular or parallel to the bone. It's kind of at an angle across the bone. So here we have an example of an oblique fracture in one of the phalanges of the hand. Next is a spiral fracture, which happens when there is some type of twisting motion on the bone that causes it to shatter. You can see in the X-ray image that it looks like a spiral kind of shape is left on the bone after it is broken in this spiral type fracture. This is an example of a femur. Here you can see the kneecap here, this is the lower leg, and here's the femur that has been twisted apart into a spiral fracture. A segmental fracture happens when you've got a break in the bone where there's two breaks and then just kind of one big chunk left in the middle, one segment in the middle. So here's an example of a segmental fracture, again, of the femur. The Greenstick fracture happens when the bone is still intact, but there is a break in it. You can see here this Greenstick fracture, it's not completely snapped all the way through the bone. This is usually more in pediatric patients because their bones aren't fully ossified yet, so they have a little bit more give to them. Comminuted fractures are really bad. They happen when the bone gets shattered into a bunch of different little pieces. So again, here is a femur. This is the top portion, the socket with the hip, and then you can see there's all these little shards of bone fragments with this comminuted fracture. Open fractures can be different types of bone fractures, but they're considered open if the broken bone breaks the skin. So you can see right here, it's not really easy to see soft tissue in a lot of x-rays, but here you can see this chunk of tibia here has pierced through the skin, so this is considered an open fracture. And finally, we have the compression fracture, which happens when there is some kind of crushing of the bone. This is most commonly found in vertebra, although you can get a compression fracture like on a skull if your skull gets thumped really hard too. But here's the example. You can see there was an undue amount of force placed on the spine, maybe from falling really hard down on your butt, and it crushed this vertebra here in the spine. So that is a compression fracture.